This is Talk Business and Politics with Roby Brock.
Welcome to today's Talk Business and Politics. I'm Roby Brock, joined by Dr. Joe Thompson. He is the Director and CEO of the Arkansas Center for Health Improvement and former State Surgeon General. Good to see you.
Glad to be with you.
And he was my son's pediatrician, too. I got to always work that in there.
That's
You
good.
saved his life at one point in time, so.
I helped out a little bit.
He was a reflex baby, and he was tough, man. I'm sure he'd love us talking about him now. He's
That's
16.
right.
He doesn't want to be talked about. There are some new laws that have come on the books here in the month of July from the last legislative session. They didn't have those emergency clauses tacked on them necessarily. So let's talk about a few of them today. A lot of them deal with public health. So let's talk about the one that requires at least 40 minutes of recess time for elementary students. This is 40 minutes per day. Why is that important?
Well, I think we have swung too far to where we're trying to test kids and teach kids all day long, and elementary school kids have energy that they have to burn off. So this requires 40 minutes of unstructured recess time each day for our younger students to be able to balance not only the learning that goes on, but also their growth, development, and physical activity.
There's also some nutritional changes there. There was a position created for a state farm-to-school coordinator. This is about eating healthy, but why do we need somebody at the state level to coordinate this?
We had growth in farmers markets and local produce across the state. I mean, most communities each weekend has now a source for locally sourced foods. And this is an opportunity to actually have those local producers be able to gain access to schools and supply schools. It's an economic development opportunity for the local grower. It's a nutrition opportunity for the school nutrition and cafeteria workers.
And one last on the school front here, there is a requirement now that schools will have to report their numbers of exemptions from vaccination requirements. We've been reading a lot about this outside of the state of Arkansas. It's not really hit in a major way in Arkansas, but what's the concern here from a public health perspective?
Nationwide, we are having a measles epidemic, a resurgence of what was at one point the CDC declared an eradicated disease. Parents are getting exemptions, sometimes inappropriately or philosophically not wanting to have their child immunized, and schools now are required to report what proportion of their student body have those exemptions, so that parents who do have their child vaccinated, or for a parent who may have an immunocompromised child, they know that the risk is there in the school.
All right, let's turn our attention to pharmacists and what's going on in the pharmaceutical area here. There was a law that was passed to allow pharmacists to dispense tobacco cessation products without a doctor's prescription. Makes sense on the surface. This is probably not difficult to figure out when somebody has a nicotine addiction. Are you okay as a doctor with that?
Tobacco continues to be the #1 threat and killer in Arkansas, and when somebody decides they want to quit, we need to make available to them at that point in time opportunities to take the action and to cease using tobacco. I think this is a good move, and it will open up the access points across the state for individuals who do smoke or use tobacco to be able to quit more easily.
And let's talk about pharmacy benefit managers. PBMs, as they are well known, they are a pariah to some. They are touted as a savior to others. I don't know where you stand on particular with PBMs. So before I ask you about the new law on that, where do you think PBMs, is there a role for them in the health system?
Well, PBMs developed to be able to negotiate with the pharmacy manufacturers and be able to steep discounts off of prices to be able to offer to pharmacies so that you and I and others, when they go to the pharmacy, can get the best price. I think what the concern is that now as they have aggregated, there are only 2 or 3 nationwide, that they're taking a slice, an increasing slice of the profit out of the pharmaceutical source, and they're charging us as consumers more and more. Arkansas has led the nation in laws to try to open that black box up. It's a difficult set of issues because it is so complex, but the insurance commissioner is taking steps, and I think the industry is going to move forward on helping us better understand why and when our pharmaceutical products cost.
There was a law passed to restrict the pricing in PBMs. What will this new law do?
Well, we had a special session, you may remember, in January to deal with what was perceived to be spread pricing, where the PBMs would give their pharmacy, if they owned it, a better price than the independent pharmacy. This law that goes into effect this month goes one step farther and opens up the public reporting of rebates and discounts so that people can see who's getting the rebate and where the money's flowing.
Transparency is always good, I found. We need more transparency in the healthcare system overall, don't we?
We spend $1 out of $5 in this state on health care, and we don't know where we're spending it and whether we're getting the value for our dollar. It's important to have transparency.
But there are statistics at the Arkansas Center for Health Improvement that help you parse through some of that.
We're trying to open it up and make our system be the best we can afford.
All right, Dr. Joe Thompson with the Arkansas Center for Health Improvement. Good to see you, sir, as always.
Thank you.
All right, thank you. That's all for today's program. I'm Roby Brock. We'll see you next time.
You'll find us at the end of a lot of long country roads, covering over 60% of the great state of Arkansas. Our 17 electric distribution cooperatives are working day and night to provide reliable, affordable power to over 500,000 homes, farms, and businesses, just like yours. The Electric Cooperatives of Arkansas, your local energy partners.
Each day, the promise of our nation begins again. Arkansas and America, moving forward. I help make that promise a reality. It's not for everyone, but people everywhere depend on us.
Oh, I love you too, sweetie.
Trucking delivers, or everything stops. And that's what drives me.